of his arms, of his legs. The resistance of the water helps build up the muscle, and then also just, the exercise will help with calorie burn and help him lose weight.
Hey, I hear him working.
Yeah.
Now, Wendy, I know that Pam was telling me you folks have a Weight Watchers program. Is this part of the curriculum per se?
Yep, he is. He comes in and we weigh him, and then we, figure out a goal weight for him, what his goal weight should be. We discuss diet, how to, sort of put him on a diet, what type of food he should be eating, how much, how many snacks he gets versus how many he should get, and then incorporate, an exercise program with it. So.
All right, everybody, this is Dr. Kris, and we are actually here working on a patient. Dr. Kris, what do we have going on here?
We have Sam here. Sam was in a fight with another dog in the household, and he lacerated a lump and it's been causing some bleeding, so we're going to use our laser to remove the lump and also stop the bleeding. And then we'll flush and clean all the small wounds that were left. So I'm just putting a drape on to keep it sterile. During all our procedures, our animals are on monitors for heart rate, oxygenation of the bloodstream, blood pressure, which is the beeping you'll hear in the background.
Dr. Kris, how long have you been practicing medicine?
Almost 20 years now. I graduated in 1986. Actually, that's more than 20 years.
You seem like you really enjoy what you do.
Oh, I do. You have to if you're going to be in this for this long. Most of the animals are fun to work with, and so are most of the clients. But it's always nice to know that you can help somebody. We also have all of our patients usually on IV catheters and fluids, just in case there were any issues. We have access directly with any medications. We don't anticipate it, we try to avoid it, but we always want to be prepared. And this is almost finished. This will leave just a little area where the lump was. We don't need to close it. It will heal in on its own very, very quickly. And there will be no more bleeding, and the dog will be very comfortable once we're finished. If we have any concerns with discomfort, we usually have them on pain medications both during the procedure, after, and when they go home. This particular procedure is not particularly uncomfortable because it's just a minor skin procedure. And that is all there is to that. And he is done.
Wow. Now, let's say before Dr. Kris there were lasers. How would you have done something like this?
We would have used a scalpel blade to remove the whole thing and then sutured it back together again. But this particular kind of mask does just as well this way. And then we don't have to have any aftercare, collars on the dogs, sutures to be removed, antibiotics, that sort of thing. So it's easier for them. You
love when there's win-win situations. So basically it saves you time, it saves the animal from discomfort, and everybody's happy.
There's less pain and there's less bleeding and there's less inflammation when we use the laser. So that's one of the reasons that we use it so frequently for a lot of our procedures. Certain procedures just are so much better. Lump removals tend to go much more quickly with much less bleeding, and the dogs seem to be much more comfortable after the procedure than the traditional way. But we do both ways, depending on the animal and the procedure.
Thank you very much. And we're at Lloyd Animal Medical with Dr. Kris. This is Ron Haley with Technology Today, signing out.
Hi, my name is Cheryl Greenwood. I am the practice manager of Lloyd Animal Medical Center. I want to welcome you to our staff in our hospital, and I would like to introduce you to our managers.
Hi, my name's Kim Waite, and I'm the technician manager here at Lloyd's.
Hi, my name's Lori Parker. I'm the operations manager here at Lloyd's.
Hi, I'm Pam Daly, and I'm the manager at Animotion.
Who's this on the floor over here?
This is Lulu Parker.
Oh.
She's
should
a
go
good
girl, say
girl.
hi.
Look at the camera and smile.
And this is your team at Lloyd Animal Medical and Emotion. You guys have fun working here, yeah?
Absolutely.
Yes.
Definitely.
Yep.
Okay, terrific. Well, you folks have a great facility here, and so glad we got to film you today. It was great speaking to you, and we'll see you guys all next week. Wave goodbye. Take care. And welcome back. We'd like to thank Animotion and the staff at Animotion and the staff at Lloyd Animal Medical for providing us access to one of the state-of-the-art facilities out here. And each week this is going to be one of the 3 segments that we go out. We're going to try to go on location for segment 1. We're going to try to highlight a cool technology in segment 2 directly online. And segment 3, we're going to go out and we're going to just talk about those things that we saw. And perhaps along the way we'll have a few special guests within the audience and we'll be interviewing them. So again, if you'd like to see yourself on air, if you'd like to see a show, feel free to email us at the listing below. And you'll be able to see some podcasts in the very near future, as well as go to ronhaley.com. Click on the link for Technology Today, and you'll be able to download a podcast directly to your iPhone, directly to your personal device, and we'll be able to view these things each week as we come out. So each and every week we are here on location at local Foxborough Cable Access, which you're feel free to go on to the website. We have some tremendous talent here in the local area, and you can see that at fcatv.org, or you can visit my personal site at www.ronhaley.com. We've got some great links out there. We've got some animations. We've even got some flash games that we've been developing, and those are just some scratching the surface of some of the things that we're going to be talking about here locally on Technology Today. So folks, thank you so much for coming out today and visiting with us. My name is Ron Haley, your host of Technology Today. We'll see you at the top.